Hello, everyone, and welcome. I'm Greg Mackling, co-host of 680 CJOB's morning show, The Start, and longtime friend of St. Boniface Hospital Foundation. It's my absolute pleasure to serve as your host for today's edition of the Health Report 2.0. Something important before we start the program today. We need to acknowledge that we are gathered on Treaty 1 territory, the traditional lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge harms and mistakes, and we dedicate ourselves to collaborate in partnership with First Nations, Inuit, and Métis peoples in the spirit of reconciliation. And it was particularly hard to get through that today because our thoughts are with the families and communities in mourning for the 751 unmarked graves at a cemetery near the former Maryville Residential School in Saskatchewan. We offer those heartfelt condolences to all those affected and restate our commitment to move forward towards reconciliation, following on the calls of the Truth and Reconciliation Commission of Canada, in order to expand our understanding of the historical events between Canada's Indigenous and non-Indigenous peoples. With all that in mind, 2021 is a big year for St. Boniface Hospital. It marks our 150th anniversary. It is also the Foundation's 50th anniversary. Over that time, and thanks to the thousands of supporters, St. Boniface Hospital Foundation has raised over $253 million, fostering innovation, discovery, and of course, compassionate care at the hospital. Like many of you who are joining us today, I know firsthand the difference that you make when you give through the St. Boniface Hospital Foundation. And I'm having a wonderful time this year chatting with some of the hospital's leaders in patient care and research, as we've done for so long in my time at CJOB and in my relationship with St. Boniface Hospital Foundation. That brings me to today's event. I couldn't be more pleased to introduce our guest today, Dr. Gigi Osler. Dr. Osler, good morning. Girl, I guess it's afternoon now.
Good morning, Greg. Thanks for having me on.
Dr. Osler graduated from medical school at the University of Manitoba in 1992. Following this, she completed a rotating internship at the Health Sciences Center and St. Boniface General Hospital from 1992 to 1993. We were discussing this a little bit before we came to air. It was one of the last graduating medical classes that did that graduating or that rotation system. So that's a little piece of special history for Dr. Osler. And she began studying, and I'm not going to try and say this, we're going with ENT at the University of Manitoba in 1993 and graduated from the residency program in 1997. This was followed by a rhinology fellowship at St. Paul's Hospital in Vancouver, BC. She has been in practice in Winnipeg since 1998, and I think I can speak for most Manitobans, Dr. Osler, when I say thank you that you returned, and thank you for returning to Manitoba from British Columbia. I made that move over the mountains once myself. It's pretty tough to come back. So thank you for doing that.
You know, there was no hesitation when, and thank you for that kind introduction. I always giggle when I talk about doing a rotating internship, because when you say that to medical students and residents nowadays, many have no idea what that means. And it was this extra year of training that you could do after medical school that has been done away with. I think I was the last class across Canada that did it. And so they kind of they scratch their heads. And, my husband and I are Winnipeggers. Our family, for the most part, is here in Winnipeg. And so we always knew Winnipeg was going to be home. So it didn't matter where we went, where we worked, offers that came by, we knew we wanted to have roots here. And we were talking earlier, and in training, we train at the Health Sciences Center, we trained at St. B. I've always had a special place in my heart for St. Boniface Hospital. It has always felt like home. The people, the staff have always had this warm, embracing feeling. And so for me, when I started my practice and came on staff at St. B, I could not have been happier and remain extremely proud of the work the hospital does.
Well, if it's okay, we're pretty proud of you as well as a Manitoban. You are, of course, as busy as you are. You're an assistant professor at the University of Manitoba. That's got to be special to teach somewhere where you attended. And of course, you help train numerous medical students and residents. And of course, your groundbreaking appointment and election as past president of the Canadian Medical Association and now president-elect of the Federation of Medical Women of Canada. So I'm going to have to get some organizational tips from you because it's not enough that you're a practicing physician. You have all this stuff to do as well. Now, we brought you on this program today and we spoke to you on the start on CJOB on Tuesday morning. And thanks for doing that with us because we want to talk about the connection that has been made via social media from the front line, so to speak, of healthcare in Manitoba over the last year. You've really done a service here, releasing dozens of video stories documenting, in particular, the second wave of COVID-19, when doctors and nurses and support staff were so busy behind the scenes caring for Manitobans and getting that message out, and that raw emotional energy and the stories from behind those front lines, those clips of nurses and therapists and others showed the toll the pandemic has taken on our healthcare workers as they struggled to keep up. So, you know, before we get going here, I want to get into this right away, but I just want to let people know that we're going to have a chat for about a half hour. And then after that, we'll be looking to our friends that have joined us online to ask your questions. We want you to make this interactive. So if you're here on Zoom, there's a chat box. Please feel free to enter your questions there. And before we wrap up for the afternoon, something special, something I've been a part of for several years as well, the 3MT, the 3-minute thesis. We talk about elevator pitches, Dr. Osler, in the business world. Well, can you imagine summing up your thesis in 3 minutes and making it presentable to everyday people? That's what the 3MT competition is all about. So we'll share some of that with you and from one of the talented graduate students training at St. Boniface Hospital's Albrechtsen Research Center. Okay, so all that said, Dr. Osler, how have you been doing? This pandemic, of course, has been difficult on all of us, but especially frontline healthcare workers and professionals like yourself. Just talk about how you've been doing and how you've been managing it all, if you don't mind.
That's a really kind question, and I want to thank you for that. Personally, I can say I have been managing as well as we all have been. My family is healthy. Most of my family is here in Winnipeg. Most of them have been fully vaccinated, so I'm thankful for that. And when I talk to my healthcare colleagues and I hear some of the stories and I hear the real stress that many people have gone through, I consider myself very privileged to be where I am right now and to not have lost any family members to COVID-19. I'll share with you, and I shared it on social media last week, my uncle, who's also my godfather, passed away last week. And he'd been at St. Boniface Hospital. He'd been having some heart issues. One of the first things my auntie said to me when I saw her was how wonderful the staff had treated him, had treated them, and had cared for them. She said, you know, they're so busy. He was in intensive care. They're so busy, but no one made us feel unwelcome. No one rushed through anything. And to me, that speaks volumes to the care that patients continue to receive at all of our hospitals. But I can speak from personal experience, the care that my family received, my uncle received at St. B. And so throughout this whole pandemic, and as we move out of the third wave, as we see more Manitobans get vaccinated, as we open up this province again, it just makes me think that we're going to get through this, and we're going to get through it not by running away from the things that we fear, but by moving towards the things that we miss and the people that we love. To be able to gather together again, to see family, to hug our loved ones. That is what's giving me hope this summer as we move out of this third wave.
I think it's always incredible in retrospect how many people, how many families are grateful for the care that they've received in hospital, even when things don't turn out ultimately how you might have hoped. When you hope and pray for a miracle or for something to go exactly as it needs to, for someone that you love to stay with us. My grandfather at 92 years old was offered heart surgery at St. Boniface Hospital and spent his last 2 weeks there. And to his last breath, I know he was grateful for the care that he received. And I'm grateful in retrospect as well. And I think that may be something that comes out of this pandemic. Maybe we don't see it now, Dr. Osler, but we might realize there's some things that we're awfully grateful for, because this experience, as difficult as it's been, maybe perspective gaining and creating for many of us.
Mm-hmm. And I don't want any of us to take for granted the hard work that everyone working in healthcare contributes to. Yes, I'm a doctor, but I'm really talking about nurses, healthcare aides, unit clerks, housekeeping staff, people that answer the switchboards. Everyone is working so hard, and this pandemic is taking a toll on their psychological, mental health, and well-being. The amount of pain that they have witnessed, we can't underestimate. So again, as we come out of the third wave, as we come out of this pandemic, as we look to reopen Manitoba and build back better, I really think that all of us, but especially those of us in leadership positions, have to really not only be grateful for healthcare's dedication and sacrifice, but really try to think, how can we do better in the future?
So that sort of leads us to the umbrella conversation today with regard to your influence, your influencer status, if you're comfortable with that in the vernacular of social media. And you took it upon yourself to share those stories. Why was it so important for you to do that? And of course, to be entrusted. I know what it's like when people trust us to come on the air and share deeply personal stories. It's an honor when they're prepared to do that and willing to do it. What was it like for you?
So social media isn't necessarily a comfortable space for many people. And many of us use Facebook to connect with family and friends. I know a lot of physician colleagues who use Twitter to get information and share information. When I was with the CMA in my role as president-elect, president, past president, you would have to do a lot of communication. So a lot of interviews. You were the spokesperson for the association. So through those years, I became more comfortable in the role of being a communicator and to be able to communicate and share health information. As the pandemic started last spring, I was still a past president of the Canadian Medical Association, so we're still doing some spokesperson roles, interviews, and communications about the pandemic. And at that time, I really started to become aware that there weren't a lot of scientists, health professionals on various social media platforms. Instagram, for one, I think that clip you showed was my Instagram homepage, and TikTok, which, believe it or not, when I first got that app last spring, thought this is just for young kids. It's just silly dances and lip syncing, none of which I am going to do. But I started using it to do some hand washing messages, like, wash your hands. And as I became more familiar with that platform, and as 2020 went on, I started to see that platform and Instagram being used for different types of science and health communications. And so I started doing more communications on the pandemic, public health messaging, to amplify and reinforce some of the messaging. Because there wasn't, especially that time, a lot of other doctors and health professionals on those two platforms, especially the TikTok one. And so it just really grew from that. And as more and more Canadians spend more time on social media, we're seeing more Canadians watch their news on social media or obtain and share information on a variety of the different social media platforms. So I wanted to be able to use my voice and my platform to amplify and share health information, public health messaging. Especially in the fall, I was sharing a lot of information about the second wave here in Manitoba. And I think everything, including the health stories, the real stories from healthcare workers series, a lot of the work that I had been doing on social media really grew to that social media campaign that I did with the hospital in December.
Well, I know it was incredibly valuable, not only to those of us in the media, but certainly to the general public, because not only on social media are you trying to stand out versus some very flashy productions and some major influencers, but also misinformation has become the enemy to so many of us these days. So it's important, I think, to have that counteracting message. And it almost seems obscene to suggest that you need to have positive messaging in order to overcome some of the misinformation, but that's just the world we live in. And emotion, we had a discussion this morning on the air about getting the message out about vaccinations and about why we need to follow public health orders. And really the revelation from the group that we spoke to was that, it's not necessarily about telling you, giving you orders. It's about touching you on an emotional level. We know that the greeting card companies are very good, and the telephone companies back in the day, their commercials at eating and getting to our emotions. And that's what some of those videos did for me. And I know for a lot of folks that saw your videos. And there's one from December. And this is where I get to play a little bit of Johnny Carson here, where we get to, can we go to the film here? Can we go to the clip, because it's incredibly powerful.
Let's go. So as my role as an educator, I have typically been supporting my own unit. However, with COVID, we've increased our numbers. We had to open up a whole brand new unit, gradually starting with just 2 patients, but the unit itself was not set up for an ICU. So it's been very difficult and tumultuous to try to get all of this material, support all of these people in terms of their education, and you constantly feel like you can never do enough. Sorry, I need to.
Sometimes the silence and the tears say more than the words themselves. That was incredibly powerful. It had a real impact on so many people. What was it like being on the other side of the camera, so to speak, taking that and collecting that feedback?
It was an incredible privilege to be able to speak to real healthcare workers. I was able to go into the intensive care unit, into the emergency department. And the idea for this series came from a nursing colleague of mine who was the manager in the OR in December. And we were talking about the second wave. And there were real concerns in the province that with the holidays coming up, perhaps people weren't going to follow public health advice. They'd get together over the holidays. And then in January, we'd see an even bigger jump in cases, because this is in December and cases were still going up. So we were talking one day and she said, wouldn't it be nice for people to hear what healthcare workers are experiencing? Because many of them are going to be working through the holidays. Many of them won't be getting together with family and friends because they'll be working, or because they'll be working so hard and they don't want to have family come over. So took that idea, went to the hospital, and the hospital was fully on board. And that's where this campaign came out of. And we called it Real Stories from Healthcare Workers. And it was a video that was aired every day over the holidays, talking to nurses, respiratory therapists, healthcare aides, physicians, asking about their experience. And I had a few questions, and everybody that I spoke to volunteered. I'd get permission to go to the unit, and I'd say, is there anybody who would like to share a story? Respecting all privacy, we made sure that no patients were seen, no health information was shared. And we just asked people, what's it been like? How has your role changed? Is there any message you'd like to share with the public? Some people didn't want to talk. Some people, and another colleague said to me, you know what, Gigi, I can't. I've cried too much today already. I can't. And others would take some time, and some said no, and others would say, yeah, I'd like to speak. And sometimes people who said, no, I can't talk, initially would come back afterwards and say, I do want to say something. And so I would catch people on their breaks over lunch. They were 60-second clips, which often we just shot in one take. So it would take them no more than a few minutes. And it was a real privilege to be able to share their stories. And I like to think, I know it made a difference. I would see some of the comments on social media. Many people, the vast majority, were so grateful for their hard work and their dedication. And it reinforced to them why following public health advice was so important over the holiday break.
I've always had this philosophy that those who enter in the medical field, whether it's a nurse, as a respiratory therapist, doctor, anyone who works in a supporting role, it's not really a job, is it? It's a calling, it's a way of life. And that's, I think, something that gets lost on the general public, is how much is sacrificed willingly, but how much is sacrificed with your own families. I know the nurses that sacrificed their summer holidays to make sure that my babies were taken care of in the NICU almost 15 years ago. There was an incredible shortage of NICU nurses at the time. And so in order for that NICU to be fully staffed, there were nurses, and I'm sure there were doctors as well, and other staff that had to forego previously planned vacations in order to make sure my babies came out of there healthy on the other side. And so for those that don't really understand that notion of it being a way of life or a calling, maybe take us inside a little bit.
And anybody who goes into, and I'll say, a giving profession, because it's not just healthcare workers, but certainly healthcare workers. I've seen it with social workers. I've seen it with people who are in different ministry positions. Anybody who's in a helping profession or role typically comes into those roles or are attracted to it because they do have a deep sense of empathy and a deep desire to work with people and to help with people. And so it is something that you see rise to the surface during crises, during pandemics like right now. And so as the pandemic goes on, and I've often said it's both a marathon and a sprint at the same time. People get tired, people get exhausted, yet they keep giving of themselves. And so my message to anybody who'll listen is always to appreciate what they're doing now, but let's make sure we look after them once the pandemic is over.
So how do we reach out? How do we show that support? Many of the individuals joining us today may not be on TikTok or Instagram. And if they are, maybe they don't follow you. I can't imagine why they wouldn't. But if they don't, maybe try and give us an understanding, of, those experiences. And I think we've done a pretty good job there, but maybe jump ahead and just this idea of how do we show our support? Because I think even sometimes, here's a great example. Just a couple of weeks ago, my wife's best friend's father passed away. And, in the midst of this pandemic, we're limited on what we can do. The public health orders don't allow us to do what's sometimes instinctual. And even sometimes we freeze. We don't necessarily know what to do to express our grief, our sorrow, our condolences. So how do we do that in appreciation? How do we find a way to send that message when maybe we've never been down this road before? Have you got some advice?
Well, one thing I'll say with the pandemic that's ongoing right now, one thing I've heard even from my own patients, they're reluctant to go to the hospital for any condition because of the ongoing COVID cases. So I think one thing I'll say is to folks, don't put your health on hold. If you do need to seek medical attention, don't be afraid to seek medical attention. All of us in healthcare are taking all the steps necessary to protect anybody, to keep you safe when you come to a doctor's office, a clinic, or a hospital or the emergency room. Certainly while you're there, any kindness, appreciation, thank yous to staff are always appreciated. I know with the hospital afterwards, if somebody would like to say thank you, the hospital does have a patient relations office, which you could contact to express thank you or support. I know the foundation always appreciates both thank yous and support in other ways. On a broader scale, we keep hearing with all of the news conferences every day, there's still significant strain on the healthcare system. And I think for all of us to continue to listen to public health advice, get vaccinated, does help reduce the strain on the healthcare system, which does help reduce the strain on healthcare workers. And, I'm so proud of our province and excited to see that we as a province have exceeded the vaccination goals that the province set out that allowed us to start reopening yesterday on Wednesday, as opposed to the July 1st deadline. So again, I think this has been a test of us as a province, as people, like nothing I have seen in 23 years of medical practice. And I know we are going to come out of it. We have to be careful this summer. The Delta variant is still around. But I think I'm feeling more hope than I have in quite a few weeks to months.
I'm with you on that. And it's always, everything's a qualification right now. Even when you ask somebody how they're doing and they answer, I'm doing great. Well, okay, as well as can be expected. There's always that qualification, that obligatory chit chat about COVID and how it's affecting us and how we all wish it would go away. And I think we're all, no matter where you are, we're all in that same boat. We're really done with it. And as the Premier says, it's not done with us yet. But the bottom line is, right from day one, yes, cases numbers and all the different metrics that epidemiologists have been looking at have been critical, but those two, boy, the strain on the healthcare system and the number of people in hospital and in the ICUs, once we get those numbers down, then we can claim a little bit of a victory, of course. I've been so privileged to ask you these questions. We've opened the floor. If you'd like to type in your questions, we'd love to hear from you. Normally I would give a phone number right now, but it's just go to your keyboard and you can type it in. Dr. Osler, for those joining us today, is there anything maybe I haven't asked you, we haven't broached upon that you were hoping you might be able to share with us that maybe didn't lead you down the right path?
Yeah, Greg, you always do a good job leading me down the path. I'm gonna loop back a little bit. We were talking about vaccines and the pandemic, and I saw a survey recently that said about 21% of Canadians still are a little hesitant to get the vaccine for COVID-19. I think here in Manitoba, we're hearing that, we're at the 70+%, but it's starting to slow down a little bit in terms of the number of people who are getting our first dose. And having questions, having concerns, being a little hesitant about the vaccine is perfectly fine. I understand that. And I'm trying to approach a lot of these discussions with a lot of understanding and empathy to provide information. And, one thing that I can say is that with the vaccines, I think the first dose of the vaccine that was given to somebody in one of the clinical trials was well over a year ago today. And still, we are seeing real world evidence of how effective the vaccines are. And when you see countries, Manitoba, Canada, when you see vaccine rates go up like that, cases, hospitalizations, and ICU admissions come down. But there will be some folks who don't get vaccinated, and the virus, as you know, is changing and mutating. So that's why there's always these cautions about, yay, we're opening up, oh, but the Delta variant is here. And this variant is something to watch out for. I don't think we should be scared of it. I think we need to watch it and be concerned. As we've seen vaccinations go up, we are opening up Manitoba. Cases are coming down, less hospitalizations. And so I think this summer, it's going to be, again, this race a little bit to get more people vaccinated, and especially with 2 doses. And that's when you're really protected against the virus and this Delta variant. So it's a bit of this race to get people vaccinated and yet open up businesses, open up the economy. Let's get back to doing things and hopefully let our kids go back to school in September.
Oh boy, is that ever a big one? We could
Yeah.
do an entire half hour on
Yeah.
that. I've got a question here from one of our attendees asking about, I'll just read it the way it's come in here. I'm concerned about working conditions for nurses and the fact that they have been without a contract for 4 years. What can the public do to influence change for nurses to improve the nursing situation?
That is a really good question. And I can't speak on behalf of my nursing colleagues. I can tell you firsthand how hard they are working. And my mom was a nurse, so I know firsthand from personal experience from working with my nursing colleagues how hard they work. And I always say that I try not to get political. I get political in terms of not being too heavy on one party or the other, but I always focus my advocacy on what's best for the health of patients, populations, and the healthcare profession. I don't want to answer that too specifically because I am not a nurse, but I will say that I think recognizing, being aware of how hard they are working right now and being supportive, both personally and professionally, listening to what the nursing profession says, what the Manitoba Nursing Union is saying, listening, being aware of that, acknowledging what we can acknowledge, all goes a long way. Recognize the hard work that they've done and recognize that I think, the healthcare system overall is strained and burdened right now. And I think being an active participant in discussions with your MP, with your MLA, with healthcare professionals about how can we make it better post-pandemic.
Vocalizing your support for the work that anybody does right now, I think goes a long way. What about backlash? Do you get backlash ever about doing the social media that you do?
So I'll say yes. I mean, social media, if you've ever been on social media, it's a platform that unless you've got special privacy settings, anybody can comment on things that you post. Things that you share on social media is not only shared with your audience, but can be shared quite widely. You never know who's looking at what you've posted or downloaded. So I have a personal credo. I try to be very respectful, informative. I don't gossip or spread rumors or myth when I'm posting information about the pandemic. Especially now, I'm trying to provide sources. So I cite the evidence, cite the research. Something's a bit unclear, I don't want to use my platform to spread more misinformation. And so I'll try to present data, evidence-based information. There can be a lot of meanness on social media, which I know everyone here is aware of. I try not to let that bother me. And certainly if something gets to be a personal attack, I try to focus on more of the positive versus the negative. But that's also what disinhibits or disinclines people to go on social media because it can be a negative and toxic place to be. But at the same time, as we've seen with the pandemic, if there's a void of healthcare voices, if there is a void of scientific, evidence-based data and information, often those spaces get filled with disinformation, misinformation, and myths. And I've had a few different groups that I work with reach out to me to ask me to dispel myths. One that just constantly boggles my mind is that the vaccine will somehow magnetize you or contains magnets. So I've done a few different videos to show that no, it contains no metal, it contains no microchip, you won't get magnetized. But that surprisingly continues to be perpetuated on social media. So I'd like to think that having those health voices out there can help occupy that space so that space doesn't get filled with misinformation and disinformation.
Yeah, no question. And to all the healthcare providers, the researchers, the epidemiologists, the science-based contributors over the last 16 months, unfortunately, other than situations like we saw with you, where you've been allowed access to go behind the scenes, the people conducting the frontline work, they don't have probably very little interest in speaking to the media, and B, don't have time to do it. They're far too busy doing other things. So it does, I think, create that void and that potentially that opportunity for people to try and fill it with what kind of memes did you call myth memes?
Oh, well, there's a lot of myths and misinformation and disinformation.
Yeah. Yeah. And we love when we can wrap it up in about 6 or 7 words and a nice little saying and a catchy phrase. And so those things catch on as well. So it's important to be able to combat those things.
Yeah, and hospitals are places of hope and healing, but they're also places where there's a lot of suffering. And so, being able to, so when I was able to do those videos, go into the hospital with the hospital's permission, with the healthcare workers' permission, honestly really was a privilege, because the hospital is often a place where people are fighting for their lives, where there's more pressing concerns, and we wanted to respect that, but still be able to communicate to people that this is serious. The pandemic is real. I can't tell you how many, especially in the beginning of the pandemic, I would get messages on social media saying, "This isn't real. Show me the people in ICU. Show me the people." And I wouldn't answer, but I would say, these are people fighting for their lives. It's not a circus. They're not in the hospital on display to satisfy your curiosity. They're trying to heal. They're trying to survive.
Yeah, absolutely. And, if I could just say this on behalf of the foundation, we had that question with regards to support for nurses. The foundation is an outstanding conduit for the public to the hospital to speak up and to show their support, either with words or, getting behind, if you're able financially to say, yeah, I support this part of the hospital. It goes a long way because the foundation has that relationship with the hospital. And and can take the pulse of the public as well. So it's a great way for our viewers and for friends of the foundation to show their support for any work that the hospital does, any program that's near and dear to your heart. It's a great way to go about it, nurses, therapists, otherwise. So I just wanted to reiterate that, or iterate it on behalf of the foundation. I'm just looking at our questions here. I think we covered most of the bases with regard to where we wanted to get to and where our attendees wanted to go today. So I just wanted to once again thank you for the opportunity to spend time with you. It's always a pleasure. I always feel more intelligent and well-informed after we've done something like this. So thank you for that, Dr. Osler. It's a genuine honor to be in your presence, digitally or otherwise.
You are too kind, Greg, and thank you for having me on. It has been delightful.
Thank you so much. We'll let you go. We know you have lots of important work to do, so continued success in that. We'll talk soon. Before we close today's event, we did promise you a peek at the People's Choice winning 3MT presented by Sanu Verghese. The 3-minute thesis, the 3MT, incredible program. It's an annual competition for graduate students in a thesis-based program. And with a career goal to work as a clinician scientist, Sanu has always been passionate about how lifestyle interventions can improve health outcomes. He represented St. Boniface Hospital Research Center in a field of 12 provincial finalists at April's 3MT competition. We hope you'll enjoy Sanu's presentation.
By the end of my 3-minute talk today, another 12 women across the globe will be diagnosed with breast cancer. Thankfully, due to the many advancements in anti-cancer agents, breast cancer is no longer the death sentence it once used to be. However, as more women are surviving their cancer, we're starting to see a more sinister side of these anti-cancer agents. Particularly, the work in our lab has shown that about 1 in 4 women who take these anti-cancer agents will develop injury to their heart. What this ultimately means is that if the cancer doesn't kill them, heart disease down the road will. This raises a very important question. Is there a way to protect the hearts of these women, but also keep these drugs within their treatment plan? Yes, enter aerobic exercise. Numerous studies have shown that exercising during the course of cancer therapy can protect the hearts of these women. So, great, problem solved, right? Unfortunately not. While we know that this exercise is beneficial for these women, actually getting them to follow through with an exercise program, it's a whole another challenge. And can we blame them? Most of the exercise programs currently in place are hospital-based. And for women who already have to come to the hospital multiple times a week, they don't want to come back to exercise. Additionally, with the COVID-19 pandemic, this hesitancy to come to the hospital has only increased. So, our research team here at the University of Manitoba designed a state-of-the-art, personalized, home-based aerobic exercise program. And compared to the hospital-based counterparts, our program provides 3 additional benefits. Firstly, it is cost-efficient as it doesn't require any additional equipment. 2, through the use of polar heart rate watches, our women are able to exercise according to their own schedules. And thirdly, perhaps most importantly, all of this can be done within the comfort of their own home. And having run this study for 1 year, our results are astonishing. Compared to the hospital-based programs, which only have a compliance of 40 to 50%, our home-based exercise program was followed 94% of the time. Additionally, compared to the group that did not exercise, by taking pictures of the heart, we're able to see that our woman who exercised was able to maintain a healthier heart during the course of their cancer therapy, meaning we can almost guarantee that they don't need to see a cardiologist in the future. So yes, by the end of my talk today, 12 women will be diagnosed with breast cancer. But this paradigm shift in bringing exercise to the home will ensure that these women don't also become tomorrow's cardiac patients. Thank you.
Thank you, Sanu. What a fantastic talk, a topic that far too many of us can relate to, which makes it even more impactful. By the way, just want to let you know, if you're on social media, Dr. Gigi Osler, Gigiosler, is on Facebook. She's also on Twitter, and a tremendous follow on TikTok and Instagram. So if you're not sure about getting into the social medias and you'd like to dip your toe, Dr. Osler is a great way to start. Even if she's the only person you follow, I would suggest it highly. So before we close today's event, I want to let you know that we all have 2 more sessions of the Health Report 2.0 coming up this year. On September 21st, it's World Alzheimer's Day, and we'll be chatting with Dr. Benedict Albenzi, a principal investigator in the Division of Neurodegenerative Disorders. Dr. Albenzi is a leader not only in Canada, but around the world, world-renowned specialist, expert, and does a wonderful job in plain language conversation, taking something that's difficult to discuss, something that impacts so many of us, and making it very understandable. So that's September 21st. And then on Tuesday, November 30th, Dr. Davinder Jassal, one of the really great guys in the medical community, in our community, is a principal investigator in the Institute of Cardiovascular Sciences, and he'll join us for our final session of 2021. So great always to connect with Dr. Jassal. We want to thank everyone for joining us today. An extra special thank you to everyone who made the production behind the scenes possible. And of course, our ever grateful and our gratitude towards Dr. Gigi Osler for spending time with us, and our friends at Bounce for producing today's event. All sorts of people to thank that, well, you know who you are, so we appreciate you very much. We'll end the session, and we invite you to join us again next time, September 21st. Thank you for spending part of your day with us.